Hello, my name is Adam Gunther, and I am the Senior Account Service Representative here at Blue Shield of California, working with the San Francisco Health Service System and their members. Thank you for taking the time to join me this afternoon to discuss the Blue Shield of California PPO plan and the programs available to you should you enroll in the PPO plan. The Blue Shield of California PPO plan utilizes the Blue Shield of California PPO network. However, you do have the option of using an out-of-network provider for a higher cost share. This allows you to see any doctor of your choosing both in or out of the Blue Shield of California network. The Blue Shield PPO plan is also available nationwide. If accessing doctors in other states, you would simply utilize the local Blue Cross Blue Shield plan when searching for doctors. Teladoc General Medicine, which is a program where you can speak to a doctor either by phone or video call anytime 24/7, is available at a coinsurance. The Blue Shield PPO plan also utilizes Accolade, which is a frontline care team of health assistants and health advocates. So consider this plan if you're looking for the flexibility to see any doctor you choose, in or out of network, and would like a personalized customer support experience. The Blue Shield of California PPO plan is a coinsurance-based plan with a deductible which must be met before Blue Shield, as the plan, pays anything. The deductible for an individual in-network is $250 and family is $750. For an individual out-of-network, it's $500 and for a family, it's $1,500. PCP, specialists, lab work, outpatient surgery in a hospital, and inpatient hospitalization are all 15% in-network after the deductible has been met, or 50% out-of-network after the deductible has been met. Chiropractic and acupuncture are both 50% up to $1,000 max per member per calendar year after the deductible has been met. For prescriptions, retail co-payments are $10 for generic, $25 for brand name, and $50 for non-preferred generic and non-preferred brand name in-network, or 50% of the balance of the prescription after the applicable copay for out-of-network. Now let's take some time to talk about some additional support and programs offered to members who enroll in the Blue Shield of California PPO plan. Available exclusively to San Francisco Health Service System members who enroll in the Blue Shield of California PPO plan is Accolade. Accolade's frontline care team of health assistants are dedicated to SFHSS members for personalized support with intelligent technology and a team of expert clinicians. Members can access this team of expert clinicians via the phone, mobile app, or member portal. Members have access to not only a health assistant, but a nurse, if needed, who can assist them with member or provider support questions, care management programs, referrals, and any other benefit questions or guidance they may need. Members can access this team by calling 866-336-0711 between the hours of 8 a.m. and 8 p.m. Pacific Standard Time. Also available to Blue Shield of California PPO members is Ginger. Accolade, together with Ginger, delivers the first collaborative care solution for members. From a frontline care team, to on-demand behavioral health coaches, therapists, and psychiatrists, to integrated data and processes. Ginger is an easy access to care, no matter where you are, when you need it, or what you're going through. Ginger offers on-demand, confidential mental health care through coaching and self-guided activities. Need to chat on a weekend or at 3 a.m. on a holiday? Ginger's around 24/7, 365 days a year. Ginger goes where your smartphone goes. Members have seen a 70% improvement within 12 to 16 weeks. There are real-time behavioral health coaching within seconds, and in-app content including mental health tips and resources, and video therapy and psychiatry sessions within days, which are available at the coinsurance as listed in your mental health benefits. Ginger is on-demand mental health care support, day or night. Yet another program available to Blue Shield of California PPO members is Hinge Health. Hinge Health is a proven end-to-end digital musculoskeletal solution. It offers SFHSS members proven outcomes for digital care for chronic back and joint pain through exercise, therapy, behavioral health, and education. Hinge Health can assist with preventative, acute conditions, chronic conditions, and surgery both pre and post by offering anytime one-on-one virtual physical therapy, exercise videos, education, behavioral changes, pre and post rehab, and continuity of care. Now let's take a brief moment to talk about mental health support and the programs available to Blue Shield of California PPO members. Blue Shield of California PPO members have access to Blue Shield's vast network of mental health providers. Members can call Accolade at 866-336-0711 for assistance in locating a mental health provider, or they can go online to www.blueshieldca.com/network PPO, click on the mental health button, and follow the steps to search for a provider on their own. As discussed in a previous slide, Blue Shield of California PPO members have access to Ginger. Ginger is easy access to care, no matter where you are, when you need it, or what you're going through. Ginger offers on-demand, confidential mental health care through coaching and self-guided activities. Need to chat on a weekend or 3 a.m. on a holiday? Again, Ginger's around 24/7, 365 days a year. Ginger goes where your smartphone goes. Blue Shield of California PPO members have immediate access to care 24/7. After standard business hours, Accolade has nurses available via the same customer service number, which is 866-336-0711, who will assist members with their clinical needs and send follow-up requests to the Accolade clinician teams. Accolade behavioral health clinicians triage any current symptoms, discuss options of care, provide treatment decision support, and provide test and treatment options to members who are in decision-making process with their providers. Accolade will send a vetted list of a few provider options via the portal or phone based on the member's preferences, or schedule an appointment with them. Blue Shield of California PPO members can access care by contacting Accolade's health assistants at 866-336-0711 or via secure messaging on the app or member portal. The Accolade health assistant and behavioral health nurse will identify the member's needs and find providers in real time via the phone, or can send via the secure app or web portal. Accolade health assistants also encourage SFHSS members to call them back if they require further assistance. Thinking about starting a family? Let's go over some programs and benefits you'll need in starting your journey. Blue Shield of California offers SFHSS qualified members pregnancy care, maternity care, and infertility treatment benefits. Members can see an OBGYN in-network or out-of-network at a higher coinsurance. Members can call Accolade at 866-336-0711 for assistance in finding an OBGYN if they haven't already selected one, need assistance in selecting one, or can go to www.blueshieldca.com/network PPO to access the Find a Doctor tool to search for one on their own. Accolade engages with expectant mothers telephonically or via the member portal. The number of interactions is based on the member's needs. Accolade meets with the members where they are in their pregnancy and addresses educational barriers, advocates in care needs with providers, and addresses symptoms, whether acute or chronic, at milestones that are based on their treatment plan. At-risk mothers will be identified, and a maternity registered nurse will work closely with them throughout their pregnancy. Accolade will educate the member on the importance of following up with their OBGYN appointments and symptoms to watch for during their pregnancy. Upon delivery, Accolade will assess the member for postpartum depression, ongoing clinical needs, assist in setting up pediatric appointments for the new baby, and remind the member to enroll the baby in the health plan. Mom and baby are then transitioned to a care management team for continuity of care and continued support as needed. For additional information or to speak to an Accolade representative about this benefit, members can call 866-336-0711 or visit member.accolade.com. Blue Shield of California also offers SFHSS qualified members infertility benefits. Single women and same-sex couples would access their infertility benefits in the same manner being described. Members would access their infertility benefits by choosing an in-network reproductive specialist or out-of-network at a higher coinsurance and making an appointment. No referral is needed. If the member would like a second opinion, they would simply search for another reproductive specialist at www.blueshieldca.com/network PPO and make an appointment, or call Accolade at 866-336-0711. 0711 for assistance. For additional information on infertility benefits, members can call Accolade at 866-336-0711, or they can go to www.blueshieldca.com/SFHSS. Need help finding a reproductive specialist? Members can use the Blue Shield of California Find a Doctor tool at www.blueshieldca.com/network PPO to search for one on their own, or can call Accolade at 866-336-0711 for assistance. Members can narrow their search by gender and language by using the filter and sort feature after they've completed their search by name and specialty. If members need assistance in using the Find a Doctor tool, they can watch a quick video tutorial at www.blueshieldca.com/watch Find a Doctor. Next, we'll go over managing a serious illness and advanced care directives. Palliative care is patient and family-centered care that focuses on quality of life. It eases the discomfort of serious illness by addressing the member's physical, emotional, social, and spiritual issues. Palliative care is appropriate at any stage of a serious illness and can be combined with ongoing curative treatments. What's available to SFHSS members? Treatment, decision, and support, care plan development and shared decision-making, home-based palliative care visits in person and via video conferencing, medical management and reconciliation, psychological support for mental, emotional, social, and spiritual well-being, 24/7 access to help and support, and caregiver support. Where is this support available? Throughout California, wherever the person needs or wants them. In their home, in clinics in many metropolitan areas, in many large hospitals, via phone or video in rural areas, in many nursing homes. Who's available to support SFHSS members? Doctors, nurses, social workers, chaplains, home health aides, and other specialists. For more information, please visit www.blueshieldca.com/palliative care or call 800-393-6130. Hospice care is medical care for those who are experiencing life-limiting illnesses and are in the final stage of life with 6 months or less left of life. Care is typically centered in the home, but can also be in a hospital or extended care facility. Hospice is provided when there is no active curative treatment being given for a serious illness. Instead, care involves support in managing symptoms. Comfort is the primary goal. Services include end of life for those who are seriously ill. The care team consists of a physician, nurse, social worker, home health aide, and chaplain. The location again can be in your home, hospital, skilled nursing, or extended care facility. Support hours are regular visits and 24/7 telephonic support. There is no copayment or coinsurance, and no prior authorization is required. Care goals are to improve quality of life and support the natural process of dying. For more information, members can call the 800 number on the back of their ID card. No one wants to think about the end of their life, but there are ways to be prepared. Writing down your wishes on an advance directive when you're healthy is just as important as when you're sick. You never know when it may be needed. You may already have an idea of the treatment you'd want toward the end of your life. For instance, if you have a condition you are unlikely to recover from, or if you're in a coma with little or no chance of ever waking up. Without an advance directive, your medical team would typically consult with your nearest family member on treatment options if you are unable to communicate. Individual members of your family may disagree on what's best, or you may want another loved one who knows your wishes better to advocate for you. Without an advance directive, others may decide things on your behalf that you would not have chosen. Members can talk to their primary care physician or call member services for assistance in completing an advance directive. Members can also go online and complete an advance directive themselves. Here are a couple of websites you can visit to start this advance directive process or get additional information regarding advance directives. The Conversation Project. The Conversation Project is dedicated to helping people talk about their wishes for end-of-life care. Prepare. Prepare is an interactive website that can help you identify your values and goals for medical care in the future. Centers for Disease Control and Prevention. The CDC offers a variety of resources about advanced care, planning, and related issues. Coalition for Compassionate Care of California. The CCCC provides online resources that can help you start the planning process and begin the conversation with others. Now let's briefly talk about managing chronic conditions. Blue Shield of California PPO members have access to Accolade case management support. Rather than having specific identification criteria which triggers an outbound call, Accolade identifies members with a chronic condition and establishes a relationship with the member when the member contacts Accolade for any type of need. Accolade registered nurses support members who have complex care needs by coordinating care, advocating for services, and consulting with their providers to ensure the members' needs are being met. Accolade uses a holistic approach with a goal of promoting and supporting the member's individual independence and self-sufficiency. Accolade works with the members to support the closure of gaps in care. Accolade clinicians do this through asking probing questions in order to help remove barriers to care, completing custom care plans for members and their families, and referring to available support resources. Members can call the 800 number on the back of their ID card if they have specific questions or would like to speak to a nurse regarding conditions they feel they need assistance with or require additional information. SFHSS members have the right to a second opinion. Members can seek a second opinion as many times as they would like simply by calling the 800 number on the back of their ID card or by searching for an in-network doctor or out-of-network doctor at a higher coinsurance anytime at www.blueshieldca.com/network-PPO and access the Find a Doctor tool. Chiropractic and acupuncture benefits are available to Blue Shield of California members, and they have any combination of spinal treatment limited to $1,000 after the deductible has been met. The member coinsurance for this benefit is 50%. Now let's talk wellness. Wellvolution, a care delivery innovation. Wellvolution is a platform that provides improved member access, convenience, experience, and efficiency by using virtual, digital, CarePoint solutions to prevent, treat, and reverse disease. Wellvolution offers digital clinical programs and services connecting members to proven resources to manage and improve health through coaching, lifestyle medicine, meditation, and mental health support and counseling. There are 4 program categories. These programs are vetted by Blue Shield and offer accessible apps based on the latest in science and lifestyle medicine to help members improve their health. These programs are available to members at no additional cost. The first program centers around stress, sleep, and resilience. The second around tobacco cessation with nicotine replacement therapy. The third around diabetes prevention, offering a CDC-approved DPP 12-month program. Members receive coaching, a digital scale, and a Fitbit. The fourth program is a condition-specific program where members receive coaching and a digital weight scale. Enrollment is easy. You will need access to a computer, tablet, or smartphone. Use Chrome if registering using a computer. To quickly download the recommended app, register using your tablet or smartphone. Customer service is available on the Wellvolution platform via instant chat, email, or telephonic support at 866-671-9644 between the hours of 6 a.m. and 6 p.m. Pacific Standard Time. To register, go to www.wellvolution.com. There, you'll need to create an account with a password. Enter your member ID, which can be found on your Blue Shield of California ID card. You will need to answer a multiple choice questionnaire of about 10 to 15 questions to confirm your health goals and needs and match you with the provider you want or provider the system recommends for you. Now you have to answer these questions honestly or the system will not direct you appropriately. Newly added to the Wellvolution platform is Headspace, and it's the full premium version, which retails for $70 a year, but as a Blue Shield of California PPO member, you get it at no additional cost. Headspace offers guided meditations, sleep casts, music playlists for focus, sleep, and dance breaks. The coaches are of diverse ethnicities and genders. What's included with Headspace? A library of 500 plus meditations on everything from stress, sleep, grief, resilience to compassion, tension-releasing workouts, relaxing yoga, focused music playlists, and more. Meditations are guided and can be 3 minutes to more than 20, depending on what you need and what you choose. Headspace is available in 5 languages: Spanish, English, Portuguese, French, and German. If you're not overweight, do not smoke, do not wish to enroll in Headspace for free, or do not have a chronic health condition, there are still wonderful resources and tools available once you register for Wellvolution. Once a member has registered for Wellvolution, they can access everyday choices via their dashboard, exercise videos, health content, and a recipe library. Here at Blue Shield of California, we want you to know that life is limitless and to never stop. Thank you for taking time with me today to go over some highlights of the Blue Shield of California PPO plan benefits and programs. There's much more information available to you as a member about this plan and programs located at www.blueshieldca.com/SFHSS. I encourage you to go out and look. Thank you, and have a great rest of your afternoon.